Hi, this is your Houston chiropractor, Dr. Gregory Johnson. We got Michael back in here with us today for his third visit here at Advanced Chiropractic Relief. Now, Michael came in here on Monday and really didn't have a lot of pain or symptoms to report, but he did have some posture questions and some balance questions and some function questions that he was concerned about. So we're really treating Michael for vertebral subluxations of the spine and pelvis, and trying to influence, we are influencing his nervous system to function at a higher level. This is his third adjustment here this week. I'd like to take this opportunity to go over something very important that we do here before and after every single adjustment, and that is we evaluate the patient's posture on the x-axis, the y-axis, and the z-axis. And the reason that we have patients close their eyes is because it takes away the three-dimensional space orientation of the visual cortex, which helps you align yourself in gravity when your eyes are open. However, when your eyes are closed, you get a much more accurate assessment of the true biomechanical configuration of the spine. So that's why we have patients close their eyes and bend their head forward and backwards. I've gotten a lot of comments and questions on that through the years, so I thought I'd just explain it to you. Okay, let's have you close your eyes and flex your head forward and backwards for me then, Michael.
Forwards?
Yep. Now, the really cool thing that Michael does, he owns his own wellness center up in the Chicago area. Michael, why don't you tell him about that? You can open your eyes for a second if you want to.
I've been a massage therapist for 33 years, and I've had Chicago Touch for 14 years, almost 15. And I share a space with a chiropractor. And I was just so fascinated with what you're accomplishing that's documented on your videos that I just knew I had to experience this, and possibly the chiropractor that I work with might be interested.
Yep. If he's interested in helping people with severe spine conditions, he definitely would be interested.
Fantastic.
Yeah. So we've already evaluated his posture. We've adjusted him now 2 days in a row, so I'm going to put him on the ring dinger adjustment first today. So Michael, let's go ahead and lay on your back on this table for me, please, sir. Any chiropractor that wants to help their patients with herniated disc and degenerative disc disease, scoot down this way just a little bit, Michael. There you go. Radiculopathy, cervical, thoracic, or lumbar radiculopathy, which is pinched nerves coming out of the spine, radiating down into the extremities or the chest. That's called radiculopathy. Numbness and tingling, which is paresthesia. Okay, slide down underneath this just a tip. There you go.
Oh!
There you go.
This is the one thing that gets sore.
Yeah, the pins are the worst part of the whole thing, actually.
Nothing else was sore.
Yeah, good. Okay, you want to keep your teeth together. Don't bite your tongue. Just like that. Yes, sir.
Oh.
See, I'm getting deeper without even pulling as hard because we tore that scar tissue loose on the first one.
Oh.
You still kicking too good.
Oh. Oh.
Uh-huh.
Ah.
Okay, tilt left just a bit. There you go. Tilt right. Looky there. Good job. Where did your chiropractor go to school? Do you know?
Palmer.
Palmer. Okay, Palmer. Go Palmer. We're all about Palmer. Let me help you up here. That's where I sent Tristan and Jeremy up to Palmer to get the best chiropractic education on the planet.
I was planning to attend Life West in San
Okay,
Antonio.
Life West is a favorite of mine too.
I did all of the prerequisites, and then I chickened out.
My mentor is a professor at Life West.
I heard about
Dr.
that.
Dan Murphy.
I'm going to watch his videos too.
Oh, he's great. Yeah, he's great. Let's go and you tell me. He's probably the foremost chiropractic educator on the planet. That's where I got all my biomechanics, biophysics, and neurophysiology education from his postgraduate seminars. In fact, I just went out to San Francisco and went and attended his chiropractic subluxation neurology course about 2 months ago, wasn't it, Renee?
Yeah.
That means you love to learn. That's fantastic.
I did. I keep my postgraduate education up every year. I go to more than what their state requirements are. It's important to me to know as much as I could possibly know to benefit my patients with it, so that's why I do it. Plus, I just have a thirst for knowledge. And any good chiropractor, in my opinion, is going to take as much postgraduate education in subluxation, neurophysiology, neurobiomechanics, and biophysics as they can to aid in the diagnosis, treatment, and rehabilitation of patients who come to us with biomechanical issues. So I've done this way a little bit now. There it is. I'm adjusting P to A here in his cervical and upper thoracic spine to remodel the cervical lordosis into a forward lordosis, which is what it's supposed to have. Let's turn you on your back now, please.
How much kyphosis do I have right now?
Not really any kyphosis now.
That's fantastic. Okay.
Yep.
We're going which way?
On your back. A lot of patients come in here with either a decreased cervical curve or reverse cervical curve just from looking down on their phones all the time or computer all the time, reading all the time. Or whiplash injuries, effects from earlier trauma. Slide down this way about an inch. And then put both arms out like this for me, please, Michael. So what all do you do in your wellness center, Michael? Chiropractic and massage.
We're focusing on medical massage now, post-op
Okay.
medical massage. I made an investment in some great equipment.
Good.
It's more effective than manual lymph drainage for helping lymph to drain back to the blood.
Mm-hmm.
And
let's sit you
the basic stuff is prenatal massage, sports massage. We have an acupuncturist who's great.
Good. Sounds like you got a multidisciplinary wellness center going. As long as you keep the meds out. You know, I'm not an anti-vaxxer or I don't want to say anti-medicine because I am anti-medicine actually.
I had a bad experience with the MMR vaccine when I was a child. I think it adversely affected me. So
Well, they put all kinds of weird stuff in those vaccines.
Yeah. Rudolf Steiner wrote about vaccines, and he
Formaldehyde, mercury, all kinds of lead, all kinds of stuff in the byproducts.
Very questionable. Very questionable.
It really is. I'll stand you up here and face this way. We were talking yesterday, I remember, about research and, we would really like somebody to step forward and fund our research for $2 or $3 million as opposed to all the pharmaceutical research that gets published. It's pretty biased.
And that's the kind of stuff you work on Thursdays and Friday, right? Is
Thursdays, Fridays, Saturdays, and Sundays while I'm out driving my vet. There we go. Okay, flex your head forward and backwards again. This should feel easier to you, Michael. Take a look in the mirror. You squared off like a military man. Now
Wow.
see your head's right down the middle.
better posture, right?
Yes, sir. That's right.
That's going to help.
Well,
you.
that's really what shows us true that we have objective evidence of the improvement that you've seen here this first couple days.
Well, and honestly, I'm preparing for public speaking.
Oh, yeah. So
including
you wanna have
videos,
good posture.
and I know that good posture
Yeah, it's
improves
important.
credibility.
That's right.
People are more trusting of someone who knows how to take care of their body.
Yeah, if you're not walking around like a Neanderthal all the time, it helps, huh?
Exactly.
Yeah, good. Well, it's been a real pleasure to treat you this week. Thank you for the honor of coming down here and giving me the opportunity.
I'm
to
very
help you.
grateful. I'm very
Thank
grateful.
you.
Thank you.
How would you describe your experience to the people that are watching our YouTube videos here? Emotional about it. That's the Holy Spirit talking here.
I'm holding back the tears.
That's good. That's the Holy Spirit.
Mhm.
We love chiropractic. We love our patients, and we'd love for you to try chiropractic with us. Go to advancedhoustonchiropractor.com and fill out a new patient request form, and Ray will get back to you within 48 hours. This is your Houston chiropractor. We'll see y'all soon.